Metabolic syndrome is a situation that consists of clustering of different cardiovascular risk factors. And most of these cardiovascular risk factors are not considered in the classical concept of stratification of risk. It's true that the definition of metabolic syndrome includes elevated blood pressure, which is a classical cardiovascular risk factors, and HDL cholesterol. But the conjunction of all these factors at the same time is not considered in this stratification. And I think that the way in which this is going to influence our clinical practice is, by being more active in these patients, being more strict in the control of classical cardiovascular risk factors, and to initiate a new era in which we will consider, the treatment to correct the cardiovascular risk factors contained in the metabolic syndrome that were not treated previously or were not considered previously in daily clinical practice. To give you an example, in my unit, patients with metabolic syndrome, when we follow them, we can follow guidelines and we can control blood pressure equally good as in those without metabolic syndrome. We can control hyperlipidemia. We can control LDL cholesterol. But then we do very little on body weight. We do little on HDL, might be a small increase with the statin. We do little on triglycerides. And when I look at, the intermediate endpoints that could be of relevance to tell me that the cardiovascular risk is rising continuously in a patient, I see that microalbuminuria is 3 times more frequent in those with metabolic syndrome. And I find that the onset diabetes is 3 times more frequent. So indicating that I need to do something else. And this something else is needed, and we need to establish exactly what to do in these patients and how to treat them.